Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Cardiac cycle. So let's look at some basics of cardiac cycle. The duration of the cardiac cycle. It is exactly about 0.8 seconds. And the HI, that is the heart rate, is nothing but 75 per minute. So first is in case of the ventricle and the atrium. So let's look at the ventricle. So in terms of the ventricle, there is a systolic phase and then there is a diastolic phase. So in case of the systolic phase, the ventricle will be about 0.3 seconds. Where in case of the diastole, it is going to be 0.5 seconds. Next is the atrial systole and the diastole. The atrial systole will be about 0.1 second. So ventricle will be 0.3 seconds systole, atrial will be 0.1 seconds. So the remaining total is 0.8, so the diastole will be 0.7. So when the heart rate increases to about 200 per minute. So when the heart rate increases to about 200 per minute, the duration of the cardiac cycle, the duration of this cardiac cycle will be equal to 0.3 seconds. Next is when the heart rate decreases. When the heart rate decreases to 40 per minute, the duration of the cardiac cycle, this will be nothing but 1.5 seconds. So heart rate increases to 200 per minute, the duration of cardiac cycle is 0.3. When heart rate decreases to 40 per minute, it is going to be 1.5. So in both situations, the change is in the length of the cardiac cycle, and it is mainly due to the change in the duration of the diastole. So there is some tachycardia, there is a ventricular filling, is greatly compromised, and this is due to the decreased duration of the diastole.